Weekend Clinic Lab Urine Dipstick Training. First, you're going to start by running controls. These have to be ran every day. As you can see, this is control level 1. It will have an open date written on it, as well as a lot number and expiration date on the side of the bottle. Here is control level 2. Again, lot number and expiration date on the side and your open date. These controls are to be stored in the refrigerator and do need to come to room temperature before testing. Here are the urine reagent strips. On the side of the bottle, there will be an open date, and here is the lot number and expiration date. You do need to make sure all testing material is in date before testing. Now it's time to begin level 1 control. You're going to start by putting in your initials for the user ID, and then you will put in QC1 for the patient ID, and then the lot number for the patient identification number. Once this is complete, you will get to the start screen, and now you can remove a strip from the bottle, being sure to immediately recap the strip container. As you can see here, I am preparing the strip and holding it in a downward angle to ensure that the bead that's created at the end of the bottle can roll down the strip. If this does not happen, ensure that every pad is fully submerged in the QC material. Be sure to dab it off on the side, not touching the strips directly to the paper towel on the top. And then you're going to press start and then wait for the next prompt to come up on the screen, which will be asking you the color and clarity of your sample. When we use the QC material, we just call this yellow and clear. And now we wait for the clinic tech to read the results of our reagent strip. After this has happened, the clinic tech will print out a result page, and this will be torn off the analyzer and put into our weekend clinic result book. In the weekend clinic result book, as you can see here, underneath the urine section in the result book, be sure to notice where each one does have a specific month to where it is easily able to find where the QC does need to be placed. When flipping to this month, you will see the result page that has the QC levels that do need to be checked off to be sure that they are within range and that your QC level is okay. Once you have done this and all the levels do match, you can go ahead and start QC on level 2. If for some reason the QC levels do not match, at this point the QC would need to be repeated and documented in the corrective action log in the weekend clinic result book. Also remember that after each test, all testing material does need to be disposed of in a biohazard container, and the test table does need to be wiped off in between each sample or QC ran on the analyzer. Now for QC level 2. You'll start by putting in your initials for the user ID, and then QC2 for the patient ID, and then the lot number for your patient identification. Always remember to check that your QC is within date, and if for some reason you ever do need more QC material, that can be found in the main lab refrigerator. Once you're at the start screen, you can now remove one test strip from the container, being sure to immediately recap your container. Again, in the downward motion, form a bead at the tip of the bottle and try to allow it to roll down the reagent strip, being sure to submerge every pad in the liquid. Turn it to its side and blot any excess liquid, and then press start. At this point, you wait for the prompt on the screen to answer the color and clarity of the sample. With the QC material, it would be yellow and clear. And now, after a few short minutes, once the analyzer is done, your results will begin printing from the top of the machine. Be sure to clean off the test table and dispose of all material and biohazard waste. Once the printout is done, tear it from the analyzer and be sure to check your results to what is in your urine result book. Again, if for any reason your results do not match, QC does need to be repeated. No patient testing can be done if QC is not within range. And urine controls must be ran every day. And all levels must be within range to be able to complete any patient testing. Now to begin urine dipstick patient testing. Starting with a properly labeled urine sample with 2 patient identifiers, you will fill out your clinician form with at least 2 patient identifiers, as well as the patient's banner ID, as this will be used as the information put in the Clinitech. Be sure to also include time in and out of the lab, as well as the person performing the test. Now to begin testing. Under Run New Test, you'll put in your user ID as your initials, and then for a new patient, you will put in the patient's initials. For the patient identification, the 900 banner ID will be used. And now you are at the start screen and ready to begin. Removing one test strip from the container and being sure to immediately recap it, and being careful not to touch the test strip pads. With the patient urine, you will get your test strip and dip it into the urine, ensuring that every test pad is fully submerged in the urine. Blotting the urine sample off on its side, you will then press Start once it is aligned on the test table. Within a few short seconds, a screen will pop up asking the color and clarity of your urine sample. If your urine sample is not yellow and clear, you will select Other to choose what clarity or color your urine is. Within a few short minutes, your analyzer will begin printing results. At this time, dispose of the used test strip into biohazard waste and be sure to clean off the test table. Once the results have printed, they will look like this. At this point, this copy can go on either of 2 places, the first being your clinician copy, and the second one being your weekend clinic result book. To print a second copy, on the screen with the results still being displayed, you simply press Print, and the second copy will be generated to put into the second location. We will be placing this copy in the weekend clinic result book under the Urine tab, where there's this spot for the patient result. Here you will also be putting your initials to show who did the testing, as well as answering yes or no if the patient did have a azo color to their urine, as this would cause interference with the patient's test results. And now I'll be showing you how to do testing if you have a small amount of urine. You'll begin by typing in your initials for the user ID, and then the patient initials for the patient name, and the banner ID for the patient identification number. Once all information has been entered and you're at the start screen, you are now ready to begin testing. You can remove a test strip from the container, being sure to immediately recap after. Then you will get a pipette to be able to draw up the small amount of liquid to then be able to place it on the reagent pads on the test strip, being sure to fully submerge all pads in the urine. Blot the strip on its side, and then press Start to begin. Once all testing is complete on your patient's urine sample, please place it in the refrigerator and the lab will discard it on the first day back. Also remember that a glucose greater than 2 plus in patients not previously diagnosed with diabetes would be considered an alert critical value. This would need to be notified to the clinician immediately, and the clinician needs to sign the alert value to acknowledge awareness.